thank you for being interested in phalloplasty surgery preparation. This is the second part of a three-part series adapted from an in-person multi-specialty transitions clinic class. If you haven't watched the initial video titled Phalloplasty Anatomy, we encourage you to do so now. Here is a sample timeline to help you think about steps to surgery. If you have questions regarding where you are on this timeline or how to initiate this process, please feel free to call us. It typically takes 8 to 10 months from referral to the first stage of surgery. Planning and timing are important considerations for a successful recovery from phalloplasty. It's important to also think about caregiver availability when scheduling. Phalloplasty requires a significant time commitment to heal and recover. This includes taking at least 6 to 8 weeks off of school or work after surgery. Phalloplasty is a surgery that typically includes multiple surgeries over the course of at least 2 years. You will have multiple consultation appointments leading up to surgery. It can be helpful to write down your questions prior to your consultation with your surgeon. It can also be helpful to bring a support person to your consultation to help you keep track of information. It's important to note that some consultation appointments include physical exams, and if you are uncomfortable at any time, you can ask the surgical team to defer your exam until a later time. Here are some of the different ways to prepare for surgery. Prior to consulting with the surgical team, it can be helpful to gather information to help you clarify your surgical goals. Phalloplasty is a surgery with multiple options, including urethral lengthening, donor site location, and implant options. You will want to weigh the risks and benefits of each surgical option as you consider what's best for you. Besides direct communication with the surgical team, it can also be helpful to hear from others who have completed surgeries and to speak with the important people in your life. Here is one tool to help you organize your thoughts about surgery. It's normal to have fears and concerns prior to any procedure, and it can be helpful to discuss your hopes and fears with your surgeon so that you can create a plan that takes these into account. Here's a sample of a completed grid to help you get started. Once you have met with your surgical team and identified your donor site, it's time to get started with hair removal. Start early. Often there are wait times to get in to see hair removal providers, and total time to completion can take as long as 12 months. Both laser and electrolysis take quite a bit of time. Usually hair grows back in cycles, so it will be important to work with your hair removal provider to determine when the hair has been cleared. It's not possible to undergo hair removal in the urethra after surgery, and there can be complications if the hair is not completely removed. This is partly why complete hair removal is so important prior to surgery. On the left is an example of the hair removal area for forearm donor site. On the right is an example of the hair removal area for an anterior lateral thigh, or ALT, donor site. Being in your best possible physical health will support your recovery and surgical outcome. Your surgeon and surgical care team will talk to you about stabilizing medical conditions before surgery to make sure it's safe for you to undergo major surgery. If you need support with your health goals, KP has wellness resources available to assist you.
Surgery preparation and recovery can feel like it's all focused on the physical body. There's also an emotional component to preparation and recovery. It's important to take care of your mental health before and after surgery. Having some mixed or ambivalent feelings about surgery is normal. Where possible, cut down on stress that is within your control. Being clear on your surgical goals and being informed about surgery and recovery are both strategies to help reduce stress and anxiety. Building your toolbox of strategies for stress reduction and self-care, as well as your network of support, can help you better cope with the emotions that come up around surgery. Start well in advance to ensure you have lots of time to practice and strengthen connections. We also have regular support groups at the MIS Clinic. Some of the groups we have available are listed on this slide. Please call our main number above for the most up-to-date information about times and groups. At any point in this process, you can reach out for mental health support. It might be helpful to know that post-op blues and depression are common experiences for many people after all surgeries. It's possible for pain medications and anesthesia to contribute to these feelings. If the feelings last or you find your coping strategies aren't enough, it's important to reach out for help. There are resources available to support you. You can always contact your primary care provider, therapist, or the multi-specialty transitions department. Patients with a history of substance use need to be sure to discuss their use with their surgeon to make sure that the anesthesia and pain medications prescribed after surgery are right for them. People with a history of addiction may also consider having someone else monitor their post-operative pain medications. As a part of being healthy before surgery, your surgical team will require that you discontinue nicotine for at least 3 months before surgery. Nicotine can impede healing. It's important to also remember that secondhand smoke can impact healing as well. Each stage of surgery requires a new set of financial planning considerations, including time off work, possible deductibles and copays, as well as surgery supply expenses. This slide contains some helpful phone numbers to get information about costs of surgery. Phalloplasty also requires depending on people for help and support in recovery. It's important to have reliable and available caregivers to assist with aftercare. Recovery from surgery can't be done alone. It can be very helpful to have a team of caregivers to rotate in to provide care. Primary caregivers can benefit by having their own support system in place as well. Most people require assistance for 6 to 8 weeks after each significant stage of phalloplasty. As you're thinking about who you want to ask to be involved in your care plan, it may be helpful to think about the questions listed. Think through the strengths of each individual in your life and who you would feel most comfortable with in each role. A backup plan B is always helpful. Common roles for caregivers after surgery include assistance with meal preparation, running errands, driving to and from follow-up visits, help with household chores, child and pet care, and emotional support. You can help organize your care by using one of the listed care calendars on the right. In summary, thinking through these various components of preparation for surgery will help set you up for an easier recovery. If you need any help in thinking through these components, please don't hesitate to reach out to the MIS Clinic. And here's how you can reach us. Thanks for learning about preparation for phalloplasty surgery. Please do call with any questions.